A Nigerian lawmaker has condemned poor funding of the country's health sector. He says this is a major reason for the growing number of cancer cases reported in the country. Deputy Chairman of the House Committee on Health, Mohammed Usman, says the poor allocation in the budget to sector contributes in no little measure to low medical tourism in Nigeria.
Budget allocation to health has been very, very low and poor. And that is why we are having a lot of challenges, in health, so today. Last year, 2016, it was 4.13%. And for this year, 2017, is what is before us today in the National Assembly is 4.17%. So if you look at, if you consider the challenges today facing health sector, you know that there's a problem, because that money, that allocation is not really enough to address the basic challenges.
A lot of those that are affected believe more in using traditional methods or spiritual avenues for management of their ailments, which has been given rise to unsavory incidences of mortality for our population. So because of that, the ministry decided that, okay, the first and main thing to do is to raise awareness of the public in order that we could get people reporting, first of all, to hospital, secondly, early enough, because cancers, if detected early, tend to be much more treatable, tend to be much more also cheaper to treat.
People are aware of cancer, but they don't have accurate awareness of cancer. So the awareness is not sufficient. The awareness sometimes is tilted to some angle. How many materials are we being translated in different languages? And that is what organizations like Project Pinglu is doing and other organizations are doing. That's number one. Number two has to do with treatment facilities. We don't have sufficient treatment facilities that can help to ameliorate and also to help to treat cancer early. Number three is the funding. Funding for cancer is terribly expensive. Not everyone can afford treatment of cancer. So there is a need, you understand, there is a need for that area of treatment to actually help people who are living in hard-to-reach community, people who don't even have sufficient food to eat to actually afford cancer. And that's why we're calling on national health insurance to figure out some specific areas that can be covered in cancer care so that people can actually survive cancer.